My name is Larry Chinnock, and I am the director of the Doctor of Physical Therapy program at Loma University. Jeremy Hubbard is here with me. He is the director of the Physical Therapist Assistant program. So those are the two programs we're going to be talking about. But as I get started, I did want to share with you some of the allied health programs that Loma University has. And hopefully I get the right screen up. Let's see. Tuan, is my screen up?
Yes, your screen is up, but I believe that you might be in a format where there's two slides that we're seeing. So if you click onto this,
all right, then let me.
Yeah, you were on presenter view, Larry.
Okay. Then let me go back to our Zoom meeting. Boy, here we go. Let's stop share and try this again. About now, is that a better one?
We're almost there. If you click onto slideshow, oh, perfect.
Yep. All right. So sorry about that. Technology is always great until it doesn't work. So Jeremy and I will be talking today. And at Loma University, let's see, I'm going the wrong way to begin with here. All right. So let me just show you at lou.edu. Hopefully this will come up. And if you click on Find a Program, which is up here at the top, and you scroll down just a little bit after.
Larry, we're just seeing your presentation.
Oh, you're not seeing the Zoom. All right. Well, then I'm going to, I'll stop that and go back to the regular one. And I got to make sure that I get the regular one. Here we go. All right. So if you go to lou.edu and you click on Find a Program, you can scroll down and you can sort by school. And so within allied health professions, there are a tremendous number of degrees. That could be in respiratory care, that could be in speech language pathology, that could be in occupational therapy, that could be in health informatics. We have about 80 different programs within our school of allied health professions at Loma Linda. Loma Linda has 8 different schools. That includes the School of Medicine, School of Pharmacy, School of Nursing. So we offer a tremendous number of degrees at our institution. So it's one of those that you can consider as you're looking to go into a different program. If you're a high school student or first year at a community college or even second year at a community college and are just trying to figure out what you want to do with your life, that's one way that you can look at all the different options that are out there. Now, Jeremy and I are going to be talking about the field of physical therapy, and we are somewhat biased in that we feel that physical therapy is a great field for you to consider. And we're going to talk about 2 different programs. One is the Doctor of Physical Therapy program, which I'm the program director. And then we're going to talk about the Physical Therapist Assistant program as well. And Jeremy is the director of that. So I am going to stop sharing and let Jeremy share his screen because he's going to talk about the Physical Therapist Assistant program first. Jeremy, you're muted.
Yeah, I just realized that. Thank you, Larry. Thanks for the introduction. And let me just pull up my screen here. Did I go backwards like you, Larry, or do you have my presentation screen?
It looks good. Very good.
Well, welcome to you all. As Dr. Chinnock said, my name is Jeremy Hubbard. I'm the director of the Physical Therapist Assistant program. I'm a graduate of our PTA program from 1999. I'm also a graduate of our then Masters of Physical Therapy program in 2004. And then Doctorate of Science in 2015. So I've spent a lot of years here as a student, and I'm grateful to be a part of this university as an instructor and as the director of the PTA program. I have a few questions for you before I get started. This is that salesman that's on TV. Are you ready for? So I'm going to be that salesman on TV for just a minute, if you don't mind. So, are you interested in a career, but you don't want to go to school for multiple years? Are you interested in one of the highest paying associate degrees in healthcare? Do you enjoy being a part of a team that helps others to walk, stand, dress, and return to work? And do you want to work in healthcare, but don't want to work crazy hours? Well, guess what? If the answer is yes to any one or all of these, then a PTA could be perfect for you. And I'm going to talk quite a bit about the fluidity of our profession, as well as some specifics about our PTA program and physical therapy in general. So what is a PTA? You see the definition there. I'll just kind of sum it up. A physical therapist assistant is a licensed healthcare professional who works under the supervision of a physical therapist. They work in a variety of fields, from hospital setting to an outpatient setting to a pediatric setting to home health and many, many others. The physical therapist is the person that does the evaluation and sets up the plan of care and is responsible for discharging the patient and so forth as well. And the PTA follows the plan of care from the PT and then participates in the treatments. In some facilities, a PTA will be, maybe a PT will see the patient initially and a PTA will see them after. In other settings, a PTA will have a complete caseload where they're the only ones seeing these patients for that day. Some good news about our profession is the job growth is expected between 24 to 35% through 2031. And our median salary, this is 4 years ago, was just about $60,000. The good news is that California is the highest paying state for PTA programs in America, PTAs in America, at around about 80,000. You'll find that more so in LA as well as up in the Bay Area in San Francisco. Although I know a gentleman not too far from us here in the Inland Empire. He's a PTA. He's a graduate of our program in 2019, and he was just sharing with me that he's making $72,000 where he's working right now. Now, I'm not saying getting a job is all about the money, but when you look at having an associate's degree, it's one of the higher paying associate degrees you can get, and I think that's a great asset to the profession. And we have flexible work areas, and we'll talk about that actually on the next slide. So PT can be in a variety of settings, whether it's outpatient orthopedics, that's that clinic that you pass by on the way to work or on the way to school or on the way home or whatever, and you see ABC physical therapy. And so the patient wakes up at their own home, they go in for care, they come back home. That's called outpatient, an outpatient setting. Orthopedics are those where it's a sprained ankle, a hurt knee, a back pain, something along those lines. Typically, orthopedic settings are work hours on Monday through Friday. It can be pretty fast-paced, depends on where the location is and so forth, but can be pretty fast-paced. Like I said, patients come in and then they go home. The second, and these two are probably the two most prominent PT settings, is in a hospital or medical center setting. In these settings, a PT could work Sunday through Saturday, so it includes Monday through Friday as well, obviously. And due to patient conditions, treatments are typically one-on-one. And so it's a little bit slower pace, but it's because of the acuteness of patients that are in their care, where you don't want to have 2 or 3 patients at a time because of the safety of patients. And patients will stay in a hospital or medical center. That's what makes it an inpatient setting. So if you want to know the difference between inpatient or outpatient, just depends on where the patient sleeps overnight. Less. If they sleep overnight in the hospital, they're considered inpatient. If they come from their home, they go to therapy and come back, that's called an outpatient setting. Some other common settings are skilled nursing facilities, inpatient or outpatient pediatric spots, home health, and outpatient neurologics. There's more than this. I'm trying to give you, this is probably covering 90%, 95% of PT settings are on what you see on my screen here. The great news about PT is that, let's say you wanted to work in orthopedics and then you decide, you know what, I kind of want to work in a hospital now. You can make that switch. If you go into other professions, I'm thinking medicine primarily, you would have to go through another residency if you wanted to do that. That's another minimum of 3 years of training before you go into another setting. In physical therapy, you can make those changes. Now, you might want to take a class or two just to kind of update yourself on that setting that you might go into that you haven't touched since you went to school. But you have the fluidity to go to a variety of settings, which is great. There are two different methods of PTA programs in the country. One is a 2-year program. Well, technically all are 2-year programs, but one is a program where you get the prerequisites as well as the PT specific courses all in one location. Loma Linda is the opposite, and I think you'll find many, I dare say most, are probably a 1+1 program, which means students go to another school to get their prerequisites. Irvine, Valley College, for example, or any other community college, 4-year college, university. They can get the prerequisites at any accredited institution. And then they apply to come into our program after a year of equivalency. Now, that may be maybe a student completes a 4-year degree. Maybe they take 2 years to complete the prerequisites because they're working at the same time or whatever. But they applied then to our program, and then we are that second one, that 1 year of equivalency of college education plus the 1 year in our program to get that associate's degree. Here at Loma Linda, our program is 15 months in length once you're on campus. Approximately half of our PTA students have a BS or a BA degree. It fluctuates between 40 to 60% from year to year. So if you have a bachelor's degree, we have many students who have bachelor's degrees in our program. If you don't have a bachelor's degree, those students also do very well in our program as well. So you don't need to have a bachelor's degree, and not having a bachelor's degree won't be a detriment to you either. We admit 1 cohort per year, usually the 3rd week in June. This year it'll be June 17. The cool thing about our school, I think, is that all of your classes are together. So when you have classes, PTA classes, they're all going to be with your class unit, your cohort. You also won't have to fret about, oh man, I hope this class is still open. I hope it's not full by the time I get to register for it. The classes will be there for you. The classes will be ready for you. You won't have to worry about, oh man, I have to take this class next quarter or next year or next semester. It's going to be ready for you at each quarter. Our current lab ratio is about 12 to 1. That fluctuates a little bit. We don't go much higher than that, and oftentimes it's a bit less than that. But it's currently 12 to 1 for our current cohort. We have 3 clinicals that are 6 weeks in length. Our students are currently on their first of 3 clinicals. They have 1 more week next week before they start back on campus. Just to give you a little idea, they started back in June of 2023. And so 9 months later, they're on their first clinical. It happens so fast, but a lot of information is given to students over those first 9 months. After this clinical, they'll come back on campus. They'll march for graduation, and then they'll have 2 more clinicals in July and August as well to wrap up. And lastly, we're one of a very few number of PTA programs in the U.S. who have human cadavers as a part of the anatomy lab. I think it's extremely helpful. You're going to be working on humans when you graduate from our program. So being able to see muscles and nerves and bones as they articulate and as they are sitting in the body is going to be vital for our graduates once they get out into the clinic. What you really want to know is, how do I get in, right? What are the requirements to get into this program? So you need to, the prerequisites to get into our program is a minimum of 1 year of equivalency previous to us. So that would be 32 semester units or 48 quarter units. Many students go well beyond that. So I don't want you to think, oh man, if I have, 60 or 80 semester units, it's not going to be too much. It'll be fine. But a minimum of 32 semester or 48 quarter units. All prerequisites must be at a level of C or higher. Our science prerequisite must be a GPA of 2.5 or higher. That would include AMP1, AMP2, as well as intro to physics with the lab. Non-science prerequisite would be 2.5 or higher. And that is all of the other prerequisites with the exception of medical terminology. The next screen that I have will talk about medical terminology as well here in just a minute. The observation hours is the same for PT and PTA. 80 hours of clinical observations required, with a minimum of 20 in both inpatient and in an outpatient setting. And the remainder could be filling up the rest of those 80 hours. And courses can be in progress. Sometimes people will start an application and they won't finish their application because they're not done with their courses. If you're going to be done with your course by late May, finish that application up, because that allows us to kind of get that process going to get you into an interview and into the next steps for being a part of the program. Just as a quick note, this is what you'll see on our website. Our website will have all this information that I'm talking about, but there's a page on there that talks about those required classes. I'm not going to go over them. I'm just kind of showing you the page here so you'll know what you'll see on our website. And you'll see those first two slots there at the top, AMP1, AMP2, and Introduction to Physics. Make sure all three of those have a lab with it. Some schools have the physics lab that you have to register for separately. Wherever you go to school, I don't know if you have to register separately or not. So just be sure that you have the labs associated with those classes. Then you'll see all the rest of the requirements on there as well. Our application process is direct to our website. You can complete the application online. There's a link on our website to the application. It says, I believe it says apply here. So you can't miss it. One thing that really helps out is if you are curious, let's say you haven't even started an application, but you're curious, hey, what might I still need to take to get into school? We are happy to do an assessment of your transcripts. All you have to do is send your unofficial transcripts to me. They don't have to be official, but send your unofficial transcripts to me. I will forward them to our admissions office. They'll complete a workup and they'll tell you specifically what classes of these you might be missing, or what classes of these that you've done and so forth, and we can proceed forward. So it's super helpful if you're curious. In addition to those items, you'll need 3 letters of recommendation. And for us to issue a letter of acceptance, we need at least 2 of those 3 science courses completed at a C or better to be eligible for an interview and then to be accepted into the program, knowing that that 3rd course is in progress and will be completed before the program starts. Once again, I'm not going to go over this page in great detail. You'll have this PowerPoint sent to you as well, so I'll get this emailed out shortly after we're done presenting here today. But it just kind of gives you a rundown of our program each quarter. We are a quarter system. I know that we have a lot of our schools around us are a semester system. We are a quarter system, so that's a little bit different, but I think we have some of the same breaks as everybody else does. But you see the classes on there. I just want to highlight when you get down to the spring. So you see at the summer is when we start, down at the spring, which is the 4th quarter there. That's the first clinical experience. That's where our students are currently at. They will come back on campus and have applied pediatrics, orthopedics, and PT practice. One other note that I neglected to mention earlier, we also purposely don't have class on Fridays for the PTA program. And the reason for that is because we know a lot of our students are either working, or they have children at home, or they have to worry about childcare, or frankly, hey, look, we all have bills. And so it's nice to be able to have a little bit of time to cover some of those bills. So we purposely don't schedule anything required on Fridays. There are some things that do happen on Friday that we encourage students to attend, but you're not penalized if you don't go. For example, this coming Friday, next week, a week from today, we're going to have a job fair here on campus, and our students won't be able to attend because they're going to be on their clinical. But if they were on campus, they would not be required to go because it's on a Friday. We try not to do that on a regular basis. For the job fair, it just happened to be that way this year, that it's on a Friday. So anyway, so our program, other than your clinicals, does not have classes on Friday. Your clinicals are at the whim of the site that you're going to. So outside your clinicals, no classes are required on Friday. Why LAU? We're the least expensive PTA program in Southern California. Our ultimate board pass rates are consistently at or above the national average. For the last cohort, I just received some results, I think a week ago, that 100% of the students who have taken the board exam have passed it for the last cohort that just graduated 6 months ago. You see a couple other items on there. Our graduation rate is 95 to 100% 1 year after graduation. Many of our instructors teach in both the DPT program as well as our PTA program. But here's the reason why you really should choose Loma Linda. Of 306 programs in the US, we were rated #1. This is according to collegefactual.com, who is, according to Forbes magazine, is one of the top 10 college ranking sites online. So we're proud of that for good reason. I've done some diligent search just to find out, hey, what other ranking sites are there out there? I'm curious. And I can't find any that actually rank PTA programs. You'll see some ranking sites that rank PT programs, medical schools, nursing, business schools, right? So you'll see all these other rankings. This is the only site that I can actually find, and if somebody else finds one, I'd be happy to hear about it. But this is the only one that I find that I've been able to find online. We're proud of that, and we're right here in your backyard, and we'd be happy to have you part of our program. You see their ranking methodology there as well. Lastly, if you need to contact us, if you want to contact us, here's our contact information. Both Jamie and I are at our desks for long hours, and so we are here at our computer. I usually, if I'm at my computer, I'm usually answering emails pretty promptly. So if you email me, I'm usually pretty prompt to get back at you. You also have our contact information down there at the bottom. Study PTA at lu.edu. You have our website, which I always kind of laugh at when I talk about, because all you got to do is Google LLU PTA. Google LLU PTA. It'll take you to our site. We're one of the first 2 spots up there. In fact, you'll have 2 that come up from Loma Linda. One is a financial page. The other one is actually our page for our program. So just Google the LLU PTA, Google LU PTA, and we should be one of the things that come up there for you as well. All right. I appreciate your time. I see that there's a question. I don't know if, Larry, if you want me to answer that question now, if that question's even for me, I don't know. Or if you want me to wait till after you've presented, Larry.
No, Jeremy, I'd go ahead and answer that question now.
Okay. How common are cap growth years in the applicant pool? It happens quite a bit. In fact, sometimes what I'll see is I'll see students that, hey, I'm interested in your program. I have 2 people right now. I'm interested in your program, but I'm in my 4th year of school, and I want to get this bachelor's degree wherever they happen to be. Okay, so they complete that. Some people will like is the actual question. They'll have a gap year and then they'll come back. That's fine. We have, as long as your prerequisites are met within the last, especially the science ones, are met within the last 10 years, that's what matters the most. So we will certainly look at transcripts with a gap year. That's not a problem. If I want to work on a professional sports team as an athletic trainer, what degree should I work for? So that could be a variety of different degrees. You mentioned an athletic trainer specifically. There are degrees specifically for athletic trainers. And so you probably want to get that degree if that's what you're looking for. I have worked with a professional athlete or 2 in the past, just in your average clinic down the street. I've actually worked with a lot of high school and junior high students in our area up here in the San Bernardino Redlands area. You know, part of that depends on the connections you have with the physicians. Part of it depends on insurances. Large part depends on insurances. But if you want to work on a professional sports team as an athletic trainer, you would need an athletic training degree. Doesn't mean they don't have PTs. They do. They have PTs, but sometimes what they'll do is they'll send, if their athletes need rehab, they'll send them out to a clinic to get that rehab somewhere that they have an agreement with, typically. So yeah, how important is clinical experience, paid or volunteer, in order to be a competitive applicant? Great question. We require a minimum of 80 hours, both the DPT program and the PTA program of observation hours. It could be work hours. Let's say you're a PT aide somewhere and you're working as a PT aide full-time and you have those hours. That looks good because it shows, at least me, that, hey, you've got this extra time in the clinic. You've maybe not been directly involved in treatments, but you've been around patients. You know how to interact with patients. You know how clinics kind of run and so forth. So you have all that experience as well. So that's important. I think, look, if you don't have a ton of clinical experience, I don't think it's a knock against you, but it certainly looks better if you have a lot of clinical experience underneath your belt. Very good. PT specific. For the PTA program, it needs to be observing either a PTA or a PT. I won't speak for Larry, but I believe for the DPT program, it must be a PT. So, all right, Larry, thank you, sir.
All right, we will come back. This is the technology as far as Zoom is concerned. Jeremy and I are not sitting in the same room exactly next to each other, even though we have the same background up. But all right, let me hopefully share the right screen. Where did my PowerPoint even go? Normally I have these all ready to go, and this one is playing games with me tonight. Put it over there. I do not see it in my. You would think I would know what I was doing, but no. Uh-oh. Let's stop share. I had these up. Share screen. Here we go. Jeremy, is it up?
Yep, just hit the presentation tab.
Yep. Okay. So I'm going to be talking about the Doctor of Physical Therapy program. I'll spend just about the next 15 minutes and then we'll open it up for question and answer at the end. So I'm going to be flying through these slides. Luckily, you'll have them to be able to look at them later if you want. But my name is Larry Chinnock, and I'm the director of the entry-level Doctor of Physical Therapy program. I'm also the chair of the department. But if you know anything about trying to get into programs, there's always one individual that you need to contact. For the PTA program, that's going to be Jeremy. For the Doctor of Physical Therapy program, that more than likely is going to be Heather Hebron here for you. I can answer questions as well, but Heather is our admissions liaison, and she will do the same thing that Jeremy would do. If you send her unofficial transcripts, she'll work them up. She'll let you know what prerequisites you might be lacking, what your GPA is, the way we're going to figure it. So here's one thing that both Jeremy and I would like to tell you. Don't be afraid to call us. Don't be afraid to email us. You want to have the right answers. You've got phenomenal advisors wherever you happen to be going to school, but they can't know all the answers for all the different professions and all the different programs that you might, excuse me, be interested in. So don't hesitate to email us. We're actually here for you. So where do physical therapists work? Some of this will be a duplication of what Jeremy said, so I'll go quickly through it, but certainly acute care, that's like in a hospital, skilled nursing facilities, outpatient orthopedics. Outpatient orthopedics is probably where the majority of the jobs are. But then we have home care. My daughter happens to be a physical therapist as well, and this is what she does. She goes out into the home and provides physical therapy services out there. Pediatrics, working with kids, that's where most of my professional work has been. Rehabilitation, this is working with individuals that have had, say, a head trauma or suffered a stroke or suffered a spinal cord injury, a broken back or something like that. And sports, and I'm going to say the same thing that Jeremy did. If you're going into physical therapy to be the trainer for the Lakers, maybe athletic training is more the field that you want to go into. It doesn't mean that physical therapists don't work with sports. In fact, we had a graduate that has been the PT for the Dodgers, has been the PT for the Angels. We've had one with the Portland Trailblazers. So they're out there, but it's a small field. Wellness is also a field that physical therapists work in because insurance companies are finally deciding it's cheaper to keep us healthy than it is to treat after we injure ourselves. Corporate consulting on ergonomics, how to keep their clients, their employees healthy. And then I always throw in this fun one, animal care. You actually can get certified in canine physical therapy or equine physical therapy. Equine is working with horses. Canine is working with dogs. We actually had one of our faculty that was canine certified. So if any of our dogs had issues, we would send them to Tony. The prerequisites that I'm going to list here are for Loma Linda, but they are pretty much standard prerequisites for all physical therapy programs pretty much across the nation. So there are a lot of great PT programs that you need to be at least aware of. And so these prerequisites that I'm going to give you are fairly standard. I'll show you the one weird prerequisite that we have that other schools may not require, but you do need a bachelor's degree to enter into a physical therapy. That bachelor's degree can be in anything. Most people probably get it in kinesiology or exercise physiology, something like that, because the degree requirements pretty much have the prerequisites to physical therapy programs built in. But I also love it when people have a bachelor's degree in business or bachelor's degree in psychology, because those are the types of things we have to deal with. It just may take you a little longer to get your prerequisites done. So it doesn't matter what your degree is in. You need a human anatomy and physiology, the complete sequence. What is a complete sequence? Whatever the complete sequence is for the school that you're attending. Then you need general chemistry with laboratory complete sequence. So this is not pre-nursing chemistry, this is pre-med chemistry. But this brings up a really good point again. If you're not sure what course you should take at your institution, email Heather. We will look up the course catalog and we'll let you know what course you need to take at the school that you're attending so that you take the right one. Same thing with general physics. That's a difficult one sometimes to know because some institutions label intro to physics with the title of general physics, and then they label the general physics with the title of general physics. So how in the world do you know which ones to take? We'll help you with that. Then you need 2 additional biological science courses. So anything with a biology prefix, just like In and Out has its secret menu, we do it as well. If you take an exercise physiology course, even if it has a kinesiology degree prefix or a PT prefix, we're going to count that as a biological science course. Then you need statistics. And for us, the one prerequisite that is not necessarily required at other institutions is this medical terminology course. We really want you to have a basic understanding of medical terminology before you come into our program. So if your institution teaches medical terminology, great. You can take it, get college credit. That grade will count towards your GPA. If they don't teach it, Heather has a list of medical terminology courses that you can take online. And if you take those and give us a certificate of completion, then we may waive that prerequisite. On the non-science side, you need general psychology, growth and development. Now, growth and development has multiple names. It could be called developmental psychology, could be called growth across the lifespan, any number of titles it might be called, but it's the course that covers normal development from birth to age 2. And then you need a speech course. Now, if you're at an institution that doesn't offer a specific speech course, but you have to give presentations throughout multiple courses on campus, then we can also look at that as far as meeting that speech requirement. Science prerequisites, no older than 10 years at the time of applications. You need to not be lacking more than 3 science prerequisites, but you're going to be applying a year in advance, so that's not inappropriate there. You'll have most of yours done. Anatomy and physiology sequence needs to be completed at the time of application. Observation hours, same thing as Jeremy, so I'm not going to go over them again, except I'm going to let you know that we know that still now after COVID, it's difficult to get your inpatient hours. We want you to do the best you can to get those inpatient hours. If you try and you can't get them, talk with us. We're not going to hold up your admissions if you weren't able to get those. It's getting easier, so it's more likely you're going to be able to get your hours, but in some places it's still difficult. If you need to retake a course, because our minimum GPA is a 3.4 in the prerequisites, and let's say you took general chemistry, you're a freshman year in college when you didn't even quite know how to study yet and got a C, and that's bringing your whole GPA down. If you retake that course, then we count the second grade only. We don't average the 2 or anything like that. So if you take it and you now get an A, it's a huge boost to your GPA. For all PT programs, or almost all PT programs, probably 98% of all PT programs across the nation, you're going to apply through a thing called Physical Therapy Centralized Application Service. We call it PTCAS. And it opens around July 1 of each year. And you can apply to multiple PT schools through one application. So you can click Loma Linda University, you can click USC, you can click Mount St. Mary's, Cal State Long Beach, whatever schools you might be interested in, you can do it through that one application. We have a priority deadline, October 1, and then our final deadline is December 1. So I'm going to encourage any of you that are looking at an institution that has a priority deadline and a final deadline, take some marker and cross out that final deadline, that December 1 deadline, and make October 1 your deadline. All PT programs get more applicants than what they can accept. So you need to do everything you can to get yourself into that group that's going to be looked at first. So always apply by the priority deadline. And what we count as your application date is when you submit your application to PTCAS. It's not when everything else comes into us. This is huge. You're going to need official transcripts sent from every institution that you've attended to PTCAS. They will sit on your application until they get that from you. So if you've gone to 4 different institutions, you've got to make a request from 4 different institutions that your transcripts be sent to PTCAS. And there seems to be a black hole out there someplace on transcripts. So I always encourage people, once they apply through PTCAS, check your application every week and make sure those transcripts have come in. If they haven't, request them again. Once they receive all your application, all your transcripts, they'll verify your application and they'll send it out to all the schools that you've applied to. Once we get it, we'll send you an invite to fill out the secondary application, and you'll have 2 weeks to do that. So based on the number of applicants that we have, we'll decide who to invite for an interview. Our interviews are usually in November and December, sometimes into January, and we normally accept into January. You will need to submit letters of recommendation. You'll need to submit your observation hours. Do not wait to submit your application to PTCAS until all those things can come in or come in. They can come in later. This is too difficult to read, but just like Jeremy presented, it is a overview of our program. The first year, we are on a quarter system. So this is year 1. This is year 2. This is quarter 1, quarter 2, quarter 3, and quarter 4. And this is the first year, second year, and third year. You will do a clinical rotation at the end of the first year. And this is really at the end of the second year, but it shows up in summer, this rotation. And then pretty much your last year, you're off on clinical rotations. So why should you come to Loma Linda? This is my time to put out some unique things about Loma Linda. I will never tell you that we're better than any other PT program. We are all different. You need to figure out what program fits you the best. The whole interview and application process is for you to make sure that the institution you're applying to is the best fit for you. And we're doing the same thing as well. Will you fit in our institution? So these are some of the things that make Loma Linda University unique. We are a faith-based institution. And if that's something that's attractive to you, then I want you to consider Loma Linda. One of the things that I like and appreciate about working at Loma Linda University is they make no apologies for being a faith-based institution. But I think that also creates a different environment on campus. You will have some faculty that will start class with prayer. If that's something that's going to make you feel uncomfortable, then probably Loma Linda University isn't one of the institutions that you want to consider. But if you like that type of environment, we're a faith-based institution. We are the least expensive private PT program in the state of California. That doesn't make us cheap because all PT programs are expensive. But if you're going to end up at a private institution, we are the least expensive program in the state of California. Mission and community service is extremely important to us. All students are involved in community service with the opportunity for international missions. We offer 15 $10,000 scholarships to students with 3.8 prerequisite GPA and higher. So there is a possibility to get scholarships. We are ranked by US News and World Report in the top 25 of all PT programs in the state, as well as in the nation. We have a very diverse student population. Excuse me, we're number one in the state for Hispanic graduate percentage and number 6 in the state for Black graduate percentage. Our graduates consistently score above the national average on the board exam for first-time pass rates. We were established in 1941, so that means we've been around 83 years with continuous accreditation. And we recently just went through our reaccreditation process and was given the maximum of 10 years. I ask our students at the end of the second year to give us the top 5 strengths and the top 5 weaknesses of the program. I'm not going to show you the top 5 weaknesses of the program, but I'm going to give you just a couple of the top 5 weaknesses. Faculty end up number 1 every single time. So just a couple quotes here. Absolute gems of professors, just glowing with kindness that really sets an example. Professors want to be your friends. They aren't just here to help you, but also have a connection with you. Professors going above and beyond. This was a huge strength of the program. So if that's something that sounds interesting to you, then I'm going to encourage you to consider Loma Linda when it's time for you to pick a program. But there are a lot of good PT programs out there. So let's see if any questions. So it looks like, do hours have to be specific? Is PT a growth industry? Yes, amazing. Not amazingly, it has been forever. I graduated in 1981, and it was listed as one of the top 10 growth by the Labor Department, and it has consistently been in the top 10 since then. Just before COVID, we were having a little bit of concern because it appeared as though we were now graduating the number of graduates that fit the openings out there. COVID has destroyed that. Right now, the job market is so open for PTs. We don't know where all the PTs went, but there are clinics that are desperate to hire PTs. So it will continue to grow because with some of us who identify as baby boomers getting older and the population getting older and living longer, there's always that need for physical therapists out there. PT is magic. Absolutely, Holly. I'm very biased and I would definitely agree with your opinion. So we have about, looks like 10 or 15 minutes. Jeremy and I are both here to answer any questions that you might have and to try to help you. And that could come from advisors, if we happen to have advisors on with us, as well as students who might be considering PT or PTA. I'm going to say one thing here for advisors and probably students. It seems like a very simple answer. Should I get an AS degree or should I get a doctorate degree? That seems to be a no-brainer. Of course, you're going to get a doctorate degree. Now, I'm the program director of the doctorate degree, so I obviously think that is an excellent field that you go into. But there are so many pros and cons of both the physical therapist assistant program versus the PT or the DPT versus the PTA. The physical therapist assistant program, if you're not quite sure what you want to do, great. This is, you may already have your prerequisites done. And then it's, just 1 year and you're out making. So I'm going to throw 60,000 out there. We can't guarantee that, but let's say 55, 60,000, something like that. So for an AS degree, that's phenomenal. For a DPT, you've got to have your bachelor's degree and then it's 3 years, but you are going to make more money over the life of your career. New graduates, I'm hearing fairly consistently now of 90,000 as new grads. That may be on slightly the higher end, but or if you're tired of school and you don't want to go to school for as long as it is to become a PT, then the PTA might be for you. So there's really no good answer that Jeremy and I can give you. It's really dependent on the individual, where they are in life, and what they need to accomplish in what amount of time. So it's not an easy decision to decide between the PT and the PTA program. Kenya says, being that your institution is faith-based, does it require prospective students to share the same belief system? Excellent question. And no, we do want the applicant to know that they're coming to a faith-based institution. But we have probably every faith and non-faith represented on this campus. They will take some religion classes while they're here. One that our students take is world religions. I really feel that when people get out into the real world and are treating patients, we need to understand some of the beliefs, the different beliefs that people have across the world, or Christian ethics. So we face ethical decisions on a daily basis in healthcare. What is going to guide us on that? So it's those types of questions or those types of religion courses that you would take. And we do have chapel one time a week that students need to attend. It's pretty much a non-denominational, they may have a praise band up front first. They have somebody speak. We have the choir from Cal Baptist come over for one of the chapels. I mean, so it is a wide variety on that. So excellent question. How much does working as a PT aide matter in terms of playing? Andy, good question. Oh boy, how do I answer this question? I'm going to say it's great if you have aide work. But I'm not going to tell you that you have to go out and get aide work to be accepted, because our faculty also know that if you've been a server at Red Robin, you've had opportunity to deal with really nice people. You've had opportunity to deal with nasty people. You've had to give customer service, and that really is half the field of physical therapy. So we recognize that not just aide work is very valuable. We do, it certainly does help if you've had some work experience. Because, we might ask a question in the interview. Tell me about a time where you had some conflict with a coworker, and how did you resolve that? Now, if you haven't had that, we'll change it to tell me sometime when you had a conflict with a classmate, and how did you resolve that? For a bachelor's degree, can it be any major, or does it have to be a healthcare related field? It can be any degree. I have a master's in business administration, so I'm biased towards people that come in with a business degree. And whether we like to admit it or not, healthcare is a business. So I think having that business background is great. My daughter had a degree in psychology before she went into physical therapy. We're working with hurting people. Having a degree in psychology is great, but getting a degree like in exercise phys or something like that, the prerequisites, more of the prerequisites are built in. So my daughter got her degree, bachelor's degree in psychology. Then she had to take another year to get her science prerequisites. So that's where a degree outside of exercise phys, biology, kinesiology, something like that may just take you longer to get the prerequisites completed. Anything else for either of us?
By the way, for those who don't know what a PT aide position is, it's not the same thing as a PTA, physical therapist assistant. It's somebody who's at a clinic, and they can help set up patients with things. They can help patients with certain activities, but their scope of what they're able to do is limited compared to what a PTA can do. PTA is somebody who's gone to PT assistant, I should say, is somebody who's gone to school and so forth for that. And aide is a helper in the clinic, is really what it amounts to, a helper in the clinic.